When someone is grappling with a serious illness, it can feel like their world has been turned upside down. The focus often shifts from everyday life to managing symptoms and navigating complex medical decisions. During these challenging times, comfort becomes very important. It's about more than just physical ease. It's about emotional and spiritual well-being too. Families want their loved ones to feel better, to experience moments of joy and connection, even if a cure isn't possible. The goal becomes enhancing their quality of life, making each day as meaningful and comfortable as it can be. Two distinct types of care can significantly help in this journey. Palliative care, which focuses on providing relief from the symptoms and stress of a serious illness, and hospice care, a specialized type of care for individuals facing a terminal illness with a limited life expectancy. People often hear these terms from doctors or nurses, especially when discussing treatment options and long-term care plans. It's natural to feel confused about what they mean, as the nuances between them can be subtle and sometimes overwhelming. Both palliative care and hospice share a common goal, focusing on easing pain and managing other distressing symptoms. Both also emphasize helping people live as well as possible, maintaining their dignity and independence throughout their illness. But there are important differences between them in terms of eligibility, the stage of illness, and the scope of services offered. Understanding these differences is crucial, will help you make the best choices for yourself or someone you love, ensuring they receive the most appropriate and supportive care. Knowing what each type of care offers can guide families during hard times, providing clarity and direction when making difficult decisions. It can also help reduce stress and fear when facing illness, empowering individuals and their families to navigate the challenges with greater confidence and peace of mind. It is okay to ask questions and seek help from healthcare professionals, social workers, and other support services. In this essay, we will look at what palliative care and hospice are, exploring their core principles and objectives, how they help patients and their families, addressing physical, emotional, and spiritual needs, and when each might be the right choice for you or a loved one, ensuring access to the most appropriate and beneficial care. Palliative care is a specialized form of healthcare. It's a special kind of care designed to improve the quality of life for both patients and their families. It offers a holistic approach, addressing not just the physical symptoms, but also the emotional, social, and spiritual challenges that often accompany serious illness. It's specifically designed for people of any age who are living with serious illnesses. These illnesses can range from cancer and heart failure to chronic lung disease and neurological disorders. Palliative care is there to provide an extra layer of support, regardless of the diagnosis. It's important to understand that palliative care is not about trying to cure the underlying illness. While curative treatments aim to eliminate the disease, palliative care focuses on alleviating the suffering caused by the illness and its treatments. Instead, the primary focus is on making the patient as comfortable as possible. This involves managing pain, controlling other distressing symptoms, and providing emotional and psychological support. The goal is to enhance comfort and dignity. The ultimate goal is to help people feel better, to improve their overall well-being and quality of life despite the challenges they are facing. It's about helping them live as fully as possible, for as long as possible. This involves addressing their well-being, both in their body and mind. Palliative care recognizes the interconnectedness of physical, emotional, and spiritual health, and aims to provide comprehensive support in all these areas. Doctors, nurses, social workers, chaplains, and other specially trained helpers all work together as a team in palliative care. This multidisciplinary approach ensures that all aspects of the patient's needs are addressed in a coordinated and comprehensive manner. They are experts in helping to control pain, shortness of breath, nausea, fatigue, and a wide range of other distressing symptoms that can significantly impact a person's quality of life. They also provide invaluable support in helping patients and families cope with difficult feelings like fear, anxiety, depression, or sadness, offering a safe space to express their emotions and concerns. Palliative care is not just for the patient. It extends its support to the entire family, recognizing that a serious illness affects everyone involved. It helps the whole family by providing emotional support, practical guidance, and assistance with decision-making. It aims to improve communication and strengthen family bonds during a challenging time. You can get palliative care at any stage of an illness, from the moment of diagnosis. It's not just for end-of-life care. It can be beneficial at any point in the disease trajectory. It can happen at the same time as other treatments aimed at curing or controlling the illness. In fact, it's often most effective when integrated early in the course of treatment, like chemotherapy, radiation therapy, or surgery. Palliative care works in harmony with these treatments to minimize side effects and improve the patient's overall experience. People do not need to stop or forego other treatments in order to get palliative care. It's an added layer of support that complements and enhances the effectiveness of other medical interventions. Palliative care can be provided in a variety of settings, including hospitals, outpatient clinics, or even in the comfort of your own home. The palliative care team works closely with your regular doctor and other healthcare providers to ensure that you receive the best possible care, tailored to your individual needs and preferences. They act as an extra support system, advocating for your well-being and helping you navigate the complexities of serious illness. Hospice care is also for people with serious illnesses, but it is a little different from palliative care. Hospice is for patients who are near the end of life, usually with 6 months or less to live. The focus of hospice is on comfort, not on curing the illness. In hospice care, doctors and nurses help control pain and other symptoms. They also offer support for emotional and spiritual needs. Hospice teams help families too, giving advice and comfort during a very difficult time. To get hospice care, patients usually stop treatments that are meant to cure their illness. The care team works to make every day as comfortable and meaningful as possible. Hospice does not try to make life longer, but it helps people enjoy the time they have. Hospice care can take place at home, in special hospice centers, or sometimes in nursing homes or hospitals. Palliative care and hospice care have many things in common. Both types of care focus on comfort. They help people feel better when they are sick, instead of trying to cure the illness. The main goal is to improve quality of life. Both services use teams of doctors, nurses, and counselors. These teams help control pain, ease symptoms, and provide emotional support. Both types of care also help family members by offering advice and support. Palliative care and hospice care respect the wishes of the patient. They listen to what matters most to you and your family. The team helps you make choices about your care that fit your values and needs. Whether you choose palliative care or hospice, you are choosing kindness, comfort, and respect. Even though palliative care and hospice are similar, there are key differences. The first difference is timing. Palliative care can begin at any time during a serious illness, even at the start. Hospice care is usually for people who are expected to live 6 months or less. Another difference is treatment. In palliative care, you can still get treatments to cure your illness. In hospice care, you stop treatments that try to cure the illness and focus only on comfort. This is a big choice for many families. Where care takes place can also be different. Palliative care often happens in hospitals or clinics, but it can be at home too. Hospice care usually takes place at home, in special centers, or in nursing homes. The care teams in both services are similar, but the focus of care changes as the illness progresses. Deciding between palliative care, which focuses on providing relief from the symptoms and stress of a serious illness, and hospice, a specialized type of care for individuals facing a terminal illness, can be a challenging decision for patients and their families. It's important to understand the nuances of each option to make an informed choice. Ultimately, the best path depends on the patient's specific needs, their personal wishes, and the stage of their illness. Palliative care is a good choice for anyone with a serious illness, regardless of their prognosis or stage of treatment. It aims to improve the quality of life even if they are still actively trying to get better and pursuing curative treatments. Palliative care can be provided alongside other medical treatments. For example, someone with cancer who is getting chemotherapy, radiation, or surgery can also receive palliative care to help manage the side effects of treatment, such as pain, nausea, fatigue, and emotional distress. It provides an extra layer of support. Hospice care is best for people who are near the end of life, typically with a prognosis of 6 months or less if the illness runs its normal course. If treatments are not working or the patient chooses to discontinue them, and the focus changes to comfort, symptom management, and emotional and spiritual support, hospice can help. It provides a holistic approach to end-of-life care. For example, a person with advanced heart disease, lung disease, or dementia who is often in pain, experiencing shortness of breath, and no longer wants more aggressive treatments or hospital stays, might choose hospice to focus on comfort and quality of life in their remaining time. Families should talk openly and honestly with the patient's doctor and other healthcare providers. Ask about what kind of care will help the most in managing symptoms, improving quality of life, and aligning with the patient's goals. Think carefully about the patient's wishes, values, and preferences regarding their care. Consider what will bring the most comfort, peace, and meaning to their life during this challenging time. Choosing between palliative care and hospice is a significant decision, and it's a personal decision that should be made in consultation with the healthcare team, the patient, and their family. It depends on how the patient feels, their goals for care, and what is most important to them and their loved ones as they navigate this journey together. Both palliative care and hospice offer strong support for patients and families. This support goes beyond just medicine. Teams help control pain, manage symptoms, and provide comfort. They also help with feelings like sadness or worry. Social workers and counselors are part of the team. They can help families talk about tough topics. They can offer advice on how to handle stress and sadness. Religious or spiritual advisors may also be available if families want them. Families sometimes need help with daily tasks. Hospice and some palliative care teams can arrange helpers to assist with bathing, cooking, or cleaning. Volunteers sometimes visit to give caregivers a break. Support does not end when a loved one passes away. Hospice teams provide help for families as they grieve, with counseling and support groups. It can be hard to talk about serious illness and comfort care, but these conversations are important. Start by asking your doctor about all your options. Tell them what matters most to you or your loved one. Be honest about fears, worries, and hopes. Ask your doctor what they expect to happen next. Request clear explanations. Do not be afraid to ask for simple words if something is confusing. Ask about what palliative care and hospice can offer right now. Find out how each could help with pain, symptoms, and family support. Ask if you can meet the care team before deciding. Remember, you have the right to choose the care that feels right for you. Doctors and nurses are there to help, not judge. When you are making decisions, it helps to have a list of questions. Here are some to consider. What kind of care can help me feel more comfortable? Can I get this care at home? Will I have to stop other treatments? How will my pain and symptoms be managed? Who will help my family? What does each service cost? How do we get started? Choosing palliative care or hospice is a brave step. It means you value comfort and support for yourself or your loved one. It shows you care about quality of life, not just length of life. Remember, you are not alone. Many families face these choices. Choosing comfort care is a way to honor your loved one's life and wishes. There is always hope, in kindness, in gentle care, and in the love you share.